Hi, I'm Dr. Ramya Narayanan from Strong Roads Dental. I have my colleague Dr. Saloni Trivedi with me today. We are going to be answering some of the most commonly asked questions about root canals today.
So a root canal is essentially something where we remove your current nerve due to different reasons, a big cavity, sensitivity, that's things we'll get into. But essentially we're removing your nerve and replacing it with a biocompatible material. And it takes away the sensation from the tooth, but it's still your natural tooth.
So one of the symptoms the patients can have is obviously pain, right? So if the patient comes in complaining of pain, there are, we take x-rays, we elicit certain responses, do some tests in the office to make sure that is a nerve pain, which means, the nerve in the tooth is dying or degenerating. That would be one of the reasons for a root canal. But sometimes the patient may not have any pain, but the decay on the x-ray might be very, very close to the nerve. So good for the patient that the patient doesn't have pain, but sometimes it can act against them because they may not come into a dentist, right? If they are not in pain. So please do go into your dentist every 6 months to make sure this is, kind of deciphered in a timely fashion.
So that's a good question. Both dentists and endodontists are trained in doing root canals.
An endodontist is a dentist.
Exactly. An endodontist just goes to more schooling, like specifically for root canals.
Correct.
But when you first see your dentist for that initial consult, they will decide whether they think, it's a simple root canal that they will take care of, or if the anatomy of your tooth or your root is a little more complex, they'll refer you over to that endodontist who, has a little more experience managing those complicated cases.
So if your dentist recommends that you need a root canal, it's probably one of the reasons I said before. The decay is very, very close to the nerve. So it's very, very time sensitive. I mean, obviously, if you're in pain, I assume you would act right away.
Right.
But sometimes, as I said, you may need a root canal and you're not in pain. Please do yourself a favor and do not delay this because, as I said, a root canal is one of the last resorts to save the tooth in your mouth.
So the only part of the root canal that you may feel is that portion where you're getting numb, that tiny pinch of the needle. Once that kicks in, otherwise you shouldn't feel the rest. And then once the root canal procedure is done, the nerve is gone. So the tooth can't really have much sensitivity anymore. The only thing that could be sore for a day or two is the gums.
Sure. I know it's one of the most commonly, used statements or said things is root canal by far is the most painful procedure in dentistry. So I would say it's right and wrong. It can be painful if the tooth is infected.
Exactly.
So generally what would happen if the tooth is infected and the patient comes in with pain, the dentist would not jump into doing the root canal the same day, right? So then we would put you on antibiotics to get that pain under control. And once that pain is under control and when you come in and you get numb, then you're not going to feel anything during the procedure. So again, when you come in and if your dentist decides that root canal is the best procedure for you, you would come back to see the dentist, you would get numb. So basically the process involves removing the existing dying or degenerated nerve and filling it up with a biocompatible material.
Right.
And sometimes, or rather most of the time, the root canal is done in one visit. But if the tooth is very infected, or if you are getting a re-root canal, which means you had a root canal in the past, and then there is some kind of secondary infection, and your dentist decides that you need another root canal, sometimes then that can become a 2-visit procedure.
So it's a great question. So root canal, as we were saying, it does take out the nerve and the nerve supply from the tooth. Obviously, if we're doing it, it's necessary, but that is a consequence of it, which means that it does leave the tooth a little more brittle, a little more weak. However, it's a very easy solution. If you put a crown over it, which covers the tooth 360, now all the biting forces are going on the crown and not on the tooth, which protects it from breaking and fracture. So basically, to answer the question, if you leave it without a crown, you're prone to more breakage and fracture.
Absolutely. So root canals, as I said, is one of the last resorts to save a tooth in the patient's mouth. So if for whatever reason it's been decided by the dentist or by the patient that we do not want to go ahead and do a root canal, the alternative is to take the tooth out and hopefully the patient decides not to, or rather patient decides to restore the missing tooth. So in which case the route would be either an implant or any other kind of restoration the patient and the doctor deems necessary.
So that question depends on what we're looking at, how much tooth is left, how much of it is decayed. It's something that we can't just answer like overall. We have to see what the tooth looks like, but we'll pick what is best for your tooth in that situation.
Right. You're absolutely correct. I mean, simplistically, trying to have your own tooth in your mouth would be one of the best scenarios.
Always.
But having said that, it depends on how long it's going to last in your mouth. So I mean, whatever we decide to do for the patient has to be in the best interest of the patient, which also means it has to last in the patient's mouth for a minimum of 10 years. If we feel it's not going to be that way, then obviously the next best alternative will be suggested.
Right.
So a gum boil typically means an abscess, which means there is some kind of secondary infection after a root canal.
Right.
Now, there could be several reasons for it. It could be like one of the reasons you mentioned before. After a root canal, there is no crown. It could be a fracture. So a fracture can cause leakage, seepage, and that causes a secondary infection. Sometimes just because of the complexity of the anatomy of the tooth, there might be some small minor accessory canals that could have been missed, where then again you have leakage and seepage and you have secondary infection. So in a nutshell, any kind of secondary infection can cause a boil. One of the things about this is sometimes, or rather most of the times, the patients do not feel it. They do not feel the occurrence of a secondary infection because the nerve is already taken out. So it can act against you. So that's exactly why we say it's important that you go back to your dentist every 6 months to get your routine checkup. So any of these things that are happening can be caught in a timely fashion.
So we kind of went over this, root canals they're good and they're done, but they can get reinfected like anything else in the mouth. All the more reason, obviously, to come every 6 months and get it checked.
Sure.
Some of the reasons, like we talked about, can be some of those missed canals, right? Complicated anatomy, things like that. Or, leaving it without a crown can cause things to kind of get inside and reinfect it.
Sure.
But doesn't mean we lose hope. If you come back to the dentist, we can always evaluate what can be done. Whether it's going to be treating that root canal again or finding some other alternative.
Pretty common. So that's exactly why we recommend a crown over it, right? Especially, again, it also depends on the position of the tooth in the patient's mouth. So if it's a back tooth where it's taking up much of the biting forces or the chewing forces, it's very essential that you get a crown over it to prevent this kind of fracture or breakage, right? But if the patient is a young patient and for some reason needed a root canal of a front tooth, and the bite is in such a way that that tooth is not hitting the opposing tooth, do we necessarily recommend a crown right away for fear of breakage? Probably not. But having said that, we do have the patient come back ever so often to make sure that the tooth is fine. And at some point, if that tooth starts changing color on the patient, at that point, we recommend a crown or a veneer.
Yes, root canals are safe. The material that we use is a researched and tested biocompatible material. So it's most definitely safe. And it's also, if possible, it's always advised so that we can keep your natural tooth and not put anything else foreign inside.
Again, there is a time period within which it can happen. So generally after a root canal, it takes about anywhere between 4 to 6 months for that bone to grow back. So generally when they come back for their 6-month recall and when we take an x-ray, we see that the bone has been regenerated around the root canal tooth that has happened. But sometimes you will see that it's not 100% regenerated. And that could be just because either there is some amount of infection left behind, okay, because it was not easy to have cleaned the whole thing out, or it could be a scar tissue. So in either case, your general dentist or your endodontist is the best person to take a look at it and see what needs to be done after.
So it's a good question. Definitely depends on your insurance. I've seen most insurances cover at least a portion of that root canal, but if you're looking for that exact number, my best advice would be to come into the office and get that worked out with the financial coordinator.
I hope we've been able to answer most of your questions regarding root canals. In case of any further questions, please don't hesitate to call us at Strong Roots.